Insights from the world's best medical minds. You are watching TheRightDoctors.com.
So we are using that phrase Delta Plus. What we have are, we're seeing the Delta variant, this B1617. And remember, this is a constellation of mutations. It's a number of mutations that are identified in this. And we've actually outlined which mutations are there in the spike protein and elsewhere. When I think, and I haven't seen the reports of the Delta Plus, but what I think this means is that there's an additional mutation that has been identified. And so what we are doing with our virus evolution working group, with clinicians around the world, with epidemiologists around the world, are to look at these specific mutations and the combination of mutations and what these mean in terms of transmission, what these mean in terms of severity, and really importantly, what these means in terms of our medical countermeasures, our vaccines, for example. In terms of the Delta variant, we do have demonstrated increased transmissibility. There are several studies that are underway that have shown this, and it's even more transmissible than the Alpha variant. And so, any increase in transmissibility makes control measures that much harder. We have seen some reports about increased severity in the Delta variant. Those studies do need to be confirmed. They need to be replicated. We need more information to determine, is it really the variant itself, or is it a combination of factors? Like I mentioned, because there's increased transmissibility, this may burden the healthcare system and may mean there aren't enough beds, or there isn't enough time to be able to give clinical care, or people are entering the clinical care pathway longer. So there's a lot to disentangle there. I don't want to, break it down to just one factor, because it's never just one factor. So we are looking at all of these mutations. And in some of the Delta variant, we've seen the Delta variant with one less mutation or one deletion. Instead of an additional, we've seen a deletion. So we're looking at all of it. And we're tracking alerts, we're tracking variants of interest, and we're tracking variants of concern. So I think to date, our teams have looked at more than 50 different variants and assessed more than 50 different variants based on available information that we have. And what we do is we update our website with the tables, and we include detailed information on each of these variants of interest as well as variants of concern in the SITREP.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.